My name is Marianno. I am a medical student and member of the research group Pelvic Floor Care Center. I'm going to present the study about pain perception assessment of microneedling technique in women with female sexual dysfunction. These are our affiliations to disclose. Microneedling technique is commonly applied for body and facial aesthetic dysfunctions. Studies show that the application of this technique in these areas has a good acceptance by patients and helps to improve self-image and self-esteem. In the genital region, there are few studies discussing the applicability of the technique in this area of the body, such as this case report conducted by our group demonstrating that microneedling in the genital region can be beneficial to patients. Therefore, some questions still remain unclear, such as the precise indication for performing the microneedling technique and, related to this study, the level of acceptance of pain by women. Therefore, the aim of the study is to evaluate the pain perception due to genital area microneedling technique in women with female sexual dysfunction. This is a descriptive study. The population is women with aesthetic complaints such as flabby skin, genital hyperchromion, and with sexual dysfunction defined by the questionnaire Female Sexual Quotient, the FSQ, which assesses and classifies the sexual function into 5 categories, since good to excellent until null to bad. The inclusion criteria was non-pregnant women, age between 18 and 65 years old, sexual function graded as regular to good or less on the FSQ, women without genital dermatosis to be treated and/or local inflammatory condition, women without complaints of infection, and women who agreed to participate voluntarily. The exclusion criteria was use of cosmetics in the genital region and use of anticoagulant medications. This research was approved by the Research Ethics Committee. The study protocol was, first of all, to carry out a basic anamnesis with the application of the FSQ questionnaire. Then, the physical examination and photographic record were done. A treatment guidance manual was provided to the patients, and after these steps, the women were randomized into 2 groups. Both groups used the microneedle roller from the company Derma-Rays, and the microneedles in group 1 had a length of 0.5 mm, and in the group 2 it had a length of 1 mm. After randomization, patients were referred to the microneedling session, which consists of 20 applications with the roller to the skin in each of the 4 directions, the vertical, horizontal, and the 2 diagonals. This protocol is similar to those presented by other studies. After the microneedling session, some topics were evaluated. Then some questions were asked to the patients, such as: how was your sensitivity to pain in relation to the treatment, with the answer options being no pain or painless, bearable pain, and unbearable pain? A numerical visual scale was applied, with 0 representing no pain and 10 representing the worst possible pain. Beyond that, the pain reported from the microneedling technique was compared to the usual hair removal technique, such as shaving, waxing, or lasering, and it was asked to the patient which one is the most painful, or if the level of pain is similar between these techniques. And finally, was asked to the patients in which location intimate microneedling was most painful, in the mons pubis, in the labia majora, in the labia minora, in the perineal, or inner thigh. Presenting our results, of the 11 women in the sample, 9 women reported that the microneedling technique is associated with bearable pain, and 2 women reported that it is a painless technique. In the evaluation of the visual numerical assessment, the group 1 reported a grade 2 pain and the group 2 reported a grade 3 pain. In the comparison to hair removal technique, 5 women reported that hair removal is more painful and 2 women reported that it is a similar pain in the 2 techniques. And regarding the painful areas, mons pubis was reported like the most painful area and the labia minora was reported as painless. Our results demonstrate that microneedling aesthetic procedure in women who have sexual dysfunction is tolerable and applicable, and since the appearance of the genital region influences the sexual function, this technique can be beneficial for these patients. It is important to emphasize that in our study the FSQ was used as an inclusion criteria and therefore it was not possible to determine the exact type of sexual dysfunction in each patient. However, this topic and others not covered by this study will certainly be addressed in future research. So, our conclusion is that the microneedling technique in the genital region may be one more therapeutic possibility for patients who present a sexual dysfunction related to an aesthetic complaint of the genital region. Thank you.